The content of this video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with your healthcare provider before starting any new exercise program. Hi, everyone, and welcome to Step Into Balance, a series for seniors brought to you by Neil King Physical Therapy. I'm Dr. Becky Pace, and today we're discussing one of the most important aspects of staying active and independent as we age: balance. Did you know that 1 in 4 older adults fall each year? The good news is there are proven ways to reduce your risk of falling. And in this video, we'll show you some of the best balance exercises and teach you how to test your balance safely at home. Balance isn't just about standing on one foot. It's a combination of strength, stability, coordination, sensation, vision, and proprioception, or knowing where your body is at in space. At Neil King Physical Therapy, we specialize in creating personalized programs to improve balance, reduce dizziness, and keep you moving confidently. Let's dive into why maintaining balance is especially important during the winter months. Winter brings beautiful, snowy landscapes, but also hidden dangers like icy sidewalks and slippery driveways. Maintaining good balance can help you stay upright and avoid falls during this time of the year. Plus, practicing these exercises now will prepare you for the unexpected, like tripping over your own feet. I'm joined by my team member, Cody, a physical therapy assistant. I realize Cody has a few years before getting her AARP card, but it's never too early to start preparing for fall prevention. Before starting any exercises, it's important to test where your balance is at now. So we're gonna go through a couple tests you might see us do in the clinic and things you can do at home. All right, we're gonna go through about 20 different exercises, just so we go over how many times you might do it now, and then we'll kind of go through all the exercises. But 30 to 60 seconds is a good goal, or 10 times on either side. And you can complete these anywhere from 2 to 3 times, and doing them daily is a great goal to make. So we're gonna start with what's called Romberg with head turns. So Romberg, we said, was right next to each other, creating that narrow base of support. So put one foot right next to each other, and we're gonna do head turns. So Cody's gonna look over to the right side and over to the left. By moving the head, not only are you changing your vision standpoint and creating a little bit of a weight shift, but you're also going to challenge your vestibular system with those head movements. So again, vision plays a role, your proprioception of where you're at in space, and also your balance and stability throughout the rest of your body. Next, you can move into tandem stance. So tandem is one foot right in front of the other, heel to toe. We're just holding it here. So we talked about different ways that you can progress or regress. This is a great one to start with a chair by you, so you can hold on either onto the side or in front of you or at the countertop. You're just gonna hold this position. And see, Cody has her arms out to the side. That makes a good strategy for improving your balance, but we also wanna challenge it. We can bring the arms across the chest just like we did with the testing. But again, always doing what's most safe for you, making sure that you feel comfortable with what you're doing, especially if you're alone at home. Next, we're gonna do heel raises. So you're just shifting your weight to your toes, lifting the heels up off the ground, utilizing those calf muscles to keep your body moving all the way up, holding for 1 to 2 seconds, and slowly lowering back down. You can do these just on the ground like Cody's doing. You can hold onto the chair. You can go to a countertop. You could go to a step if you wanna make it a little bit harder and let the heels drop down just a little bit more. And to make it really hard, you can move to trying to do it on just one side. So just doing a single leg and lifting the heel up. So this can be very simple, or we can make it a lot harder as you start to progress through your program. Next is standing hamstring curls. So again, we're gonna turn, hold on to the chair, and then you're gonna bend the knee and just flex the knee into that position, utilizing the hamstrings. So you're just gonna bend the knee, bringing the foot up towards your butt, and creating those hamstrings to contract and practicing the single leg balance. Again, a lot of these you're gonna see is that you're using that single leg, but we're also working on the muscles that we use to maintain our upright position or do certain functional movements throughout the day. Again, starting with both hands on the chair, one hand on the chair, or you can be at the countertop. These are great things to do when you're just doing the dishes or doing certain chores at home. Great, easy ways to work them in throughout your day. Next, we're gonna do standing marches. Same idea, we're just moving the leg in a different way. So we're just thinking about lifting the knee up towards the ceiling, keeping the knee bent, holding that position for 1 to 2 seconds while maintaining good upright posture. The pelvis should be staying level. We don't wanna see is the shoulder starting to lean over the side that you're balancing on. Then that shows that we are definitely not using the muscles that we're supposed to be able to hold those positions at upright. And obviously we need to make it a little bit easier. So if you need to, again, use your arms for more support, or you can move a little bit quicker and not hold it for quite as long. Next, we're gonna do a sit to stand, something we do all the time, right? So we are gonna start with just a standard chair that you might see in a doctor's office. Starting in a sitting position, allowing your body to shift forward, keeping your body upright all the way up and slowly lowering your body back down. Great way to help yourself a little bit is by using your hands on your legs. You might already do that, or you can push them off from the chair. These are gonna be great to be able to progress by going from a lower surface, which this is probably pretty hard, but you can also do something like sit to stands off of your bed if it's a little higher up, or you can add something that's gonna bring you a little bit higher off, like a pillow or a cushion. Play around with the surface. You're gonna notice that it's harder to get in and out of some chairs than it is others. We're gonna do hip abduction next, and that's bringing the leg out to the side. So holding onto the chair, again, making sure that you feel like you have nice upright posture throughout the whole body, kicking the leg out to the side. This is not only working the movement leg, but again, we're focusing on the balance of the leg that we're standing on. All the muscles in the hip should start to feel like they're working. Using an arm or a hand on the chair or at the countertop, whatever feels like it's challenging to you, but still safe and effective. Next, we're gonna do something called penguin waddles. So we're gonna keep a little bit wider base of support, and it's just like it sounds, like you would imagine a penguin waddling. So you're going to keep your core engaged by gently drawing your belly in and shift your weight over and just lift your foot up just a little bit off the floor. You can progress this by holding it a little bit longer, or you can regress it by just doing it a little bit quicker. But again, your goal is to maintain stiffness throughout the body. You see Cody has her hands out, has something nearby just in case. And again, if you feel like this is super easy, cross your hands across your chest. And any of these you could also make harder by technically closing your eyes. But again, feel safe with eyes open first, moving into making it harder for yourself, and base it on what you feel like you need to work on. Next, we're gonna do a staggered weight shift. So you're gonna put one foot in front of the other, just like you're mimicking walking. You're gonna shift your weight forward, going into the toes, shifting your weight back into the heel. Again, some of these you're completing about 10 times on either side, but make sure you complete them on both sides. We don't wanna have just one side done and not do the other. So switching either side, good. Again, make sure your body's staying upright so that you're not leaning forward into it, and you're focusing on feeling that entire transitional movement from the heel all the way to the toes. We're moving into standing arm reaches. We're gonna do this both forward and to the side. So Cody's gonna have her feet shoulder width apart, hands are reaching outwards, and then we're gonna reach forward by hinging at the hips. Make sure your knees are unlocked. You do not wanna feel like you're hyperextending your knees. And then your bottom is shifting back, your chest is staying upright as you lean forward. The great way to feel like more stable with this exercise is going in front of the countertop and reaching forward in front of the countertop, so you can imagine that something's there to catch you if this is something that's difficult to do. Good. Using the chair in front is also an option, or if you have pain in your shoulder, you can also use one arm at a time or one arm. Then you're gonna do to the side. So you're gonna put one arm out to the side, shift the weight over, and then you should feel some of your weight shift into the right foot or the side that you're shifting to. But you're still keeping both feet on the ground. You're not necessarily lifting that foot up. You're maintaining contact to the ground and feeling the weight shift more so over to the right side and reaching outside of your base of support. Next, we're gonna do toe taps. So find a step or something that you have around the house, like a stair, and we're just going to tap the toe. Again, working on single leg balance now. So we're gonna stabilize ourselves on one side, tap the toe up, bring it back down. Tap the other toe up, bring it back down. Again, you can alternate, or you can complete one side, do 10, complete the other side and do 10. Pay attention to form here. You want shoulders lined up over the hips, making sure that as you're standing on one side, you're not leaning all the way over, losing your balance and that such. And if you have a rail, this is a perfect thing that you can do is hold onto the rail as you're doing it. And the higher the step, the harder it will be to activate into your hips. So you could also change the height of the step to make it harder or easier. Next, we're gonna do step up. So we already just tapped the toes. Now we're gonna do a full step up. So you're gonna put the foot onto the step and then slowly lower yourself back down. It's very common to see that we just see that knee cave and it's not controlling the motion. So again, we're still focusing on strengthening of the lower extremities here. So not only are we working on balance, but we're also working on strengthening the legs. So we're gonna have good form while doing this. So nice, slow, and controlled while doing these. Feel the knees and the hips engage as you're pushing yourself up and slowly lowering yourself back down. Again, 10 times on one side, 10 times on the other, or you can alternate. Remember the leg that's working when you're stepping up is the first one you step up with, but the stepping down is the one that's left on the step. Next, we're gonna do a hurdle step over. Not everybody has a hurdle at home like we have in the gym here, but you have a broom or a cane or something small enough to step over. Again, the smaller the object, the easier it'll be. So you're gonna do stepping to the side, up and over the cane or broom or whatever you have at home. And again, if something to progress this is something with more height, if you have something you can step over with more width, those are all gonna challenge your body a little bit more. You can also do this forward and backward, but this one we're just showing to the side. Next, we're gonna start to get a little bit more dynamic. We're gonna do different types of walking. So this one's gonna be a tandem walk where we're walking from heel to toe. And again, you see Cody's gonna start with her arms out to the side to create a little bit of a balance strategy to start. Once it starts to feel a little bit easier or you wanna challenge it, cross the arms over your shoulders and do about 10 times one way, 10 times the other. Or if you're limited to your countertop, go back and forth about 5 times, whatever works for you. Again, you wanna challenge your body, but feel safe at the same time. Next, we're gonna do side steps. So we're gonna step to the side and create nice upright posture and just stepping within the base of support that feels comfortable without leaning your body to the side. And then she's stepping over just within the base of support that feels comfortable for her. If you need to shorten that step a little bit, that's okay too. Do what feels comfortable and safe for you in that moment. And again, using the countertop is a great way to make sure you feel safe and comfortable doing this at home. Next is backwards walking. So again, make sure you have a good amount of space here, make sure there's nothing in the way. And then you're going to, instead of going heel to toe with normal walking, go toe to heel. Nice, slow and controlled, slowly shifting your weight backwards. Good, next we're gonna do quarter turns. A lot of times throughout the day, we're gonna change positions. We have to go to get into the car door or we're just turning around to see something behind us. So moving your body in this way is going to be a great way to practice to create the reaction that you need to maintain upright position. So you're gonna turn 90-degree angle and go all the way in a circle. And then once you get straight ahead forward, you're gonna unwind and go the other direction. These I would say is probably fine to do about 5 times each direction, going in a full circle being 1 repetition. So again, you can see she's opening her hip up, the toes are leading first and the other side is staying forward until then you're gonna come back and bring it around. Something like the quarter turns, it's great to use a cane or assisted device if you're feeling unsure or unsteady with what you're doing so that you have it right next to you because that countertop's not gonna move with you necessarily. Next, we're gonna do clock reaches. So you're gonna imagine a clock on the floor and imagine all the numbers. You're gonna reach and tap each of the numbers as far around as you feel comfortable. So starting with 12, 1, 2, and so on. If that feels too hard, you can just do 12, 3, 6, 9 o'clock. Challenge yourself to what feels good for you. And you can see Cody here is bending her knee to challenge her leg a little bit more with a little bit more strength. But if that's too much, you can just maintain that stability and balance in one leg and then just tap forward and out to the directions of the clock that feel comfortable for you. Make sure you're completing on both sides. And again, something like this, probably 5 times on each side is a good place to start, but working your way up is always appropriate for progression as well. Lastly, single leg balance. We started with it as a test, we're gonna end with it as a treatment. So we're just shifting our weight over to one side, lifting the other leg up. Again, making sure we're looking at creating balance throughout the entire body. So the foot's working, the knees working, the hips working, core is working, and we're holding this position. What can help with balance sometimes is finding something to focus on in front of you. So if you have something in your kitchen where you can just look at it, kind of focus on it, draw your abdominals in, it's gonna help to create a little bit more stability throughout your entire body, and you might find it makes these a little bit more doable. Here are some additional tips to stay balanced. Wear supportive, non-slip shoes. Keep your home free of tripping hazards like loose throw rugs or cords. Watch out for small animals too. And use a walking aid if you need to, a cane, a walker. You can talk to a therapist about what might be best for you. Balance improves with consistency and patience. So practice, practice, practice these exercises daily for the best results. Thank you for joining us in our Step into Balance series. These exercises are designed to help you stay active, safe, independent, and confident. For personalized guidance, visit neilkingpt.com to set up an appointment with a physical therapist who can tailor a program for your specific needs. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more tips, exercises, and insights to keep you moving and feeling your best. Don't forget to click the notification bell so you never miss an update. Stay safe, stay balanced, and see you in the next episode.